Months after he was discovered dead at his home, friends, actor Matthew Perry, who openly battled alcohol and drug abuse for decades, passed away from the acute effects of ketamine, according to an autopsy report released on Friday by the Los Angeles County Medical Examiner. On October 28, Perry was discovered unconscious in a hot tub. Perry, who also had the opioid buprenorphine in his system, drowned in an accident, according to the coroner's office. According to the report, he also suffered from coronary artery disease. The effects of the opioid buprenorphine were also listed by the medical examiner as a factor in his demise. Strong anesthetic ketamine has gained popularity as a substitute treatment for mental health issues that are difficult to treat, such as anxiety, depression, PTSD, and other conditions. In October, the Food and Drug Administration released a warning regarding the risks associated with using compounded versions of the medication to treat mental illnesses. Perry was on ketamine infusion therapy, according to the autopsy report, and his most recent treatment was roughly a week and a half before he passed away. The report stated that because ketamine has a half-life of 3 to 4 hours, or less, it could not have been from that infusion therapy that was in his system when he passed away. The autopsy results had taken months to reach, and in October, experts cautioned it would take a considerable amount of time to thoroughly conduct a toxicology screening and examine other evidence. Due to Perry's well-known reputation, the county's robbery and homicide division detectives looked into his death right away and subsequently declared that they had not found any evidence of foul play. The department stated on its website in the days after Perry passed away that the announcement of his cause of death had been deferred. That usually means more research is required. Perry's case was eventually completely taken down from the website. Dr. Judy Melinek, a forensic pathologist unaffiliated with the investigation into Perry's death, said that test results can take weeks because of a lack of qualified toxicologists, funding, and equipment. Perry detailed some of the health issues he has had throughout the years in his 2022 memoir, Friends, Lovers, and the Big Terrible Thing. These issues included a string of medical incidents in 2018 that included pneumonia, an exploded colon, and a brief stay in the hospital. Perry was just 24 when he was cast in Friends, a show that would forever change his life and one that would firmly plant his feet in the limelight. That sitcom ran for 10 seasons from 1994 to 2004, and eventually earned him and his co-stars $1 million per episode. Following his passing, messages of condolence from friends and family flooded the internet, with many honoring Perry for his acting prowess, generosity, and bravery in the face of adversity. In a joint statement, his friends, castmates expressed their shock at Perry's unexpected passing and called him utterly devastated. The statement read, "We were more than just castmates. We belong to a family." According to People, Perry had a private funeral on November 3rd. According to the source, a service was held at Forest Lawn Memorial Park, a cemetery that is home to several of the biggest names in Hollywood, such as Bob Barker, Debbie Reynolds, and Paul Walker.